evening, and glad to have you join us on another episode of the program, Easy Access to Healthcare for All, a program that brings you news and happenings around the National Health Insurance Authority and the health insurance space at large. The NHIA organized a 3-day workshop for budget and planning officers in charge of the Basic Healthcare Provision Fund. This is to ensure seamless implementation of the fund, which caters for the vulnerable in our society. Details of the workshop and other activities around the National Health Insurance Authority makes up our package this week. I am Aisha Muhammad Ahmed, your regular anchor. Join me after the break for the full package of the program. Please stay tuned.
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We really enjoying it.
We appreciate their effort.
First on the program is a highlight of event around the NHIA. In the news, NHIA DG Lord's Health Insurance Scheme says it is the most viable healthcare financing mechanism. Also in the news, NHIA cautions stakeholders against provision of poor services.
Should be able to purchase that benefit package.
The Director General of the National Health Insurance Authority, NHIA, Professor Nasir Sambo, says health insurance is the most viable healthcare financing mechanism that can engender equity. Professor Sambo said this while speaking at the Summit on Financing Primary Healthcare in Nigeria, held in Abuja between the 5th and 6th of October 2022. He sheds more light on the scheme.
Proportionate equity is where a poor or somebody who has a meager resources that cannot be able to provide for health to get health care, he will contribute into a fund, and a rich will contribute into the same fund and be able to provide the same benefit package to them. That is one of the key issue that we must understand. So pooling of risk and pooling of resources is very, very important. The bigger the pool, the more ability to undertake cross-subsidization. The smaller the pool, the more difficult for you to be able to do cross-subsidization.
It speaks further on why health insurance ecosystem in Nigeria is decentralized.
And ideally, if we are to practice health insurance in Nigeria, with a very big pool, you need to have one pool. But the fiscal reality, the political economic reality in Nigeria will not allow that. Therefore, you have to decentralize the health insurance ecosystem so that you have people at their own level developing the pool and managing the pool.
Professor Sambo explained how the health insurance scheme is meant to ensure that the poorest of the poor are captured in the scheme.
And even in the all World Bank documents, there are some people that will never have ability to pay. That is why the concept of shifting the resources, arbitrage, how do you shift resources for the poor? And how do you devise mechanism to provide subsidy and protection for those who cannot afford? And that is why we are having all these basic healthcare provision fund, vulnerable group funds, to complement for the people that cannot be able to pay. Because you don't want to leave anybody behind.
He also gave a summary of what health insurance is all about.
In summary, sir, you need to pool resources together to be able to have a very large pool, and you need to pool risks together to be able to do cross-subsidization so that the rich will pay for the poor, and the people that are well can cross-subsidize for the people that are sick, and so on and so forth. You need to have a benefit package which is fully costed, and that benefit package should be able, your fund that you have realized should be able to purchase that benefit package if you are to do health insurance. Otherwise, fragmented pools are not equal to the implementation of social health insurance. Thank you very much.
The National Health Insurance Authority has cautioned healthcare providers against the provision of substandard services to enrollees. The Nasarawa State Coordinator of the NHIA, Mrs. Mary Aliu, stated this at the Stakeholders Forum held in Lafia, the Nasarawa State capital. Mrs. Aliu added that the forum was an avenue to educate and sensitize service providers and other stakeholders on the new NHIA Act and discuss its implementation. She also urged the healthcare providers to respect the rights and privileges of enrollees for improved health status. At the end, Mrs. Aliu commended the Director General, Professor Nasir Sambo, for good health policies and programs that have direct bearing on the health status of Nigeria.
Welcome back. Capacity development for staff and stakeholders is one of the key strategies the NHIA is applying to help it fulfill its mandate. In this episode, we'll bring you details of the recent workshop held for budget and planning officers of the Basic Healthcare Provision Fund in the Northern Zone. Let's find out how it went in our next segment, Issues Around the NHIA. Please stay tuned.
Why we are here is because we are in
The National Health Insurance Authority on Tuesday, the 4th of October 2022, organized a 3-day workshop for budget and planning officers in the Northern Zone. The workshop brought participants from the NHIA across the Northern Zone, as well as representatives from the state's social health insurance agencies across the region. The objectives of the workshop include to constitute state's focal teams for Basic Healthcare Provision Fund, to discuss and to standardize program reporting templates, to discuss and standardize templates for budget and workshops planning, to identify challenges and why improvements or changes would be made as a result of feedback. The Acting General Manager of the Informal Sector Department, Dr. Sikiru Salauddin, who was represented by Ahmed Stephen of the department, gave the opening remarks. He said the essence of the workshop was to help the NHIA achieve its mandate as they work in synergy with stakeholders.
The rationale for this workshop is because we want to get it right. More so, we want all the agencies, including our NHIA state office, to continue to work in synergy so that we can get it right. And also, when we get it right, there will be uniformity in what we'll be getting from the state offices and the agencies across the country.
The workshop commenced with the constitution of a focal team, which consists of a representative of one state NHIA staff and one state social health insurance representative. Okechukwu Ndaguba, who led this session, explained its importance.
Sometimes when we want to do budget work plan, we contact your CEOs. All right. The CEOs will probably pass the job to some of you here. All right. But they probably are not even passing the right information because we give a template and then we expect that you fill that template and bring it back. But sometimes some of the templates we see are not the templates and it's very difficult for us to analyze. So if you don't standardize it, then analyzing it will be very difficult. So that's what we are going to learn here. So that state focal person will ensure that it is that standard template that is returned to us because he understands what we are saying. All right. So if we were 1-1, fine, we'll just stand up and constitute the teams. But now, just give you 1 minute, please. Just talk amongst yourself. Then each state will now tell us the name of the focal person that they are going to.
There was a brainstorming session with participants on budget and work plan. The session also digests budget execution, which is the final stage of the budgeting process.
If you have a clear, specific objective and your strategy, what you need to be successful is to get a work plan template. We know what is a work plan template, isn't it? Huh? Work plan templates. Then a work plan template now specifies the activities, the task to be done, that's the activities, the responsibilities, who is responsible for what, then what is the objective of that activity, then like you said the timelines. When are we going to commence the activity and when is it going to end?
There was a presentation on the Basic Healthcare Provision Fund program, which highlighted coverage so far, funds disbursed, enrollment, and other issues.
So far, the total money we have received so far and has been disbursed to states, we have 29,272,977,994. This is the total money disbursed so far from 2019, 2020, and 2021. Actually, we always start this one 2022 because we paid this January, but actually it's for 2021, but it was paid this January. So, what have we been doing? Validation, access to care, commence in 30 states. That's very good. Please, state, can we clap for ourselves, please? Can we do that? Please clap for ourselves. We know it takes a long time, and before we could get to this level, having 30 states commence access to care, we need to clap for ourselves. We know at the state level we've been doing a lot of work.
After this presentation, a new template for the development of a work plan was introduced. Participants were grouped and given a specification to develop a work plan to cover the implementation processes of the Basic Healthcare Provision Fund. The work plan is expected to include administrative charge, monitoring and evaluation, quality assurance, ICT, other activities that should not be in the budget. Each group gave a presentation on the area developed.
Conduct 5 days quarterly quality assurance visit to at least 25% of the empaneled healthcare facilities by 15 persons. Then conduct 1 day non-residential training of facility managers on quality assurance, 2 persons per facility in 4 clusters. Conduct 1 day inspection and enforcement visit to 2 facilities weekly by 3 persons. Conduct 2-day remediation mentoring visit to challenge facilities by 2 persons. Conduct 3-day quarterly complaint handling and resolution visit by 5 people. Here, every quarter, we select a zone and conduct remediation and handling of complaints.
We will be able to come with 10 activities that shouldn't be in the work plan for Basic Healthcare Provision Fund or the budget. The first one there is purchase of drugs and consumables. It's the facilities that purchase drugs and consumables. We give them capitation. It's never for them to go and purchase. We don't put that in our work plan or budget. The second one is renovation of healthcare facilities. That one, it comes through the primary healthcare, what they give them from primary healthcare gateway. They do that. We don't put that in our budget or work plan.
Welcome back from that break. Easy access to healthcare continues with our stakeholders segment. Today on this segment, we'll bring you excerpts from interviews with participants of the workshop that held in Nasarawa State. They share their impression of the workshop.
The workshop is very timely because the Basic Healthcare Provision Fund, this project is actually a novel project in Nigeria, and it's important that we start it off on a very good note, because if you don't understand how the entire program is supposed to be, then there is going to be room for errors. But the planning and the budgeting workshop is actually very timely for us, especially the state social health insurance agencies, because in these few days we're trying to harmonize a reporting template, as well as have a harmonized budgeting system, so that we don't have exclusive templates, but we can actually have one that can be compared amongst all the states.
Well, it's a way forward, honestly, because ever since the implementation and operationalization of the Basic Healthcare Provision Fund, things are not that moving well. Why I said things are not that moving well is because states are operating on parallel basis, and there is need for the 36 states and FCT to harmonize the operationalization of the Basic Healthcare Provision Fund, such that the implementation of the program will be in line with the operational guideline of the Basic Healthcare Provision Fund, and such that if one state is operating, all the forms or format of operationalization of the Basic Healthcare Provision Fund will be the same in the whole 36 states and the national.
Some participants from the National Health Insurance Authority speak on the outcome of the workshop.
It's a good one. It's a timely one, because it will help us that deal directly with the state agencies to have a unified reporting template. Before now, it has been something we do off head and off book, trying to, with the rule of the thumb, trying to see we have an output. But now with this, reporting will be made easy, as the authorities of the NHIA will not find it difficult to gather reports from the states.
Capacity building in general is what makes an organization. And after that, more especially things that concerns planning. The whole issue here is issue of planning, budget, report writing, and so on. Any organization that fails to prepare on how it plans its activity is subject to failure. So I think this particular workshop will impact not only me, but each and every staff of the National Health Insurance Authority and the state social health insurance agencies nationwide. So as you can see, it is a great success already.
Participants from the state social health insurance agencies also speak on how the workshop will make their job easy.
Before now, we have been making a lot of assumptions and think it was right. So it's a guide to help us improve in our budgeting subsequently. There are things that are not necessary, and honestly, we've not been considering the guidelines of the basic healthcare financing. But this, as we're derailing a little bit, but with this training, it has brought us on track and to do the needful. That's exactly what we think, and there's going to be commitment in all that we'll be doing henceforth.
The way this training is going, there's a lot of knowledge that was impacted on me, seriously, by execution of my BSCPF budget and also the work plan. So by doing your work plan correctly, it will enhance you carrying out your activity successfully by reaching the target population you want to. The training is very, very good, seriously. It's good because they tell us what are the budget line and what it entails for you to do and how to go about it in order to achieve the universal health coverage we are all targeting.
You have heard from participants at the workshop sharing their impressions and relevance of the issues discussed to their work. We'll now take your questions in this last segment of the program.
Where do I register? How can I get? Where do I register? How can I get enrolled?
How can I get enrolled?
What are the channels of complaints for enrollees?
Okay, like I said, mentioned earlier, the routes of transmission. They can either walk into the office, that means they come in person, and we have offices across all the 36 states of the Federation. They can write. If they write to the Director General at the headquarters, it will eventually go back to their states. Like I said, they reside in a state, the facility is in a state, so we have a state coordinator. So they can write directly to the state coordinator by post, maybe hand delivered, or they could write through email. They could make telephone calls to the call center or the telephone numbers of the state office, and then through our social media handle, Twitter. Now we have a YouTube TV, and then sometimes even when we hold events, workshop and seminars, people come up and they lay complaints. So all of these complaints are actually collated, and we have what we call a monthly enforcement register. You know, that even from the state offices, they send to us over here. You know, so those are mechanisms that we've put in place to ensure that the complaint handling system of the authority is intact.
Where do I register? How can I get? Where do I register? How can I get enrolled?
How can I get enrolled?
It is a program that is designed to ensure nobody is left behind in the health insurance ecosystem.
It's an excellent scheme to support Nigerians.
I've been benefiting from this scheme.
It's very nice. We really enjoying it.
We appreciate their effort.
With this, we've come to the end of today's package of the program, Easy Access to Healthcare for All. Please make it a date with us again, same time and on the same station for another interesting package as we continue to bring you more stories around the NHIA as it marches towards universal health coverage for Nigerians. See you next week.